Hi, I'm Laura Flanders of The Laura Flanders Show. Watch every week on Free Speech TV, Link TV, YouTube, or if you're in New York, CUNY TV. Prefer to listen? Subscribe to the free podcast at lauraflanders.org. I end every week with a commentary. I call it the F word. Here's this week's.
Guest commentary comes by way of Kenyon Farrow, senior editor of TheBody.com and TheBodyPro.com. Breaking down the racial and economic disparities, he shares his insights on COVID-19. This virus outbreak affects the most vulnerable communities while exposing a broken healthcare system in the United States. How will communities come together during this pandemic, and what policies need to be addressed from government? Here's Kenyon Farrow.
Most infectious diseases, they tend to travel the routes of inequality in any society. If we already look at what we know about just some of the risk factors in terms of senior citizens and people who have some underlying kind of health issues there, we know that there are racial disparities in diabetes, for instance, in hypertension impacts African Americans and Latinos in this country, and heart disease. So we may potentially, over time, see some real racial stratification in terms of who is impacted, and also just given that so many workers who are unable, say, to take off because they're in service industry jobs, tend to be more Black and brown folks. One of the things that came out of the AIDS epidemic is that it did bring people together in a moment where things were really unsure, to really take care of one another, but also fight like hell to live. And if that meant, fighting the government, the hospitals, public health, researchers, pharma companies, people fought. And so I think we need to kind of carry that same spirit in thinking about what it is we need to do to take care of our personal selves and also our loved ones in our just larger community. But also, what does this expose about the kinds of things that we don't have in place as a society that will prevent this from happening in the first place? So we should be fighting like hell for paid sick leave. We should be fighting like hell for Medicare for all. We should be fighting like hell for lower drug costs. We should be fighting like hell for people to have access to these things. To think about all of this kinds of infrastructure that we don't have in place, that this virus exposes, that we take care of one another and continue to fight for our lives.
If you've yet to subscribe to our podcast, do it through your favorite podcast app. And if that app is Apple Podcasts, please take a moment to write a review. It helps us spread the word. Thanks.